Good morning, everybody, and welcome to the very first episode of Mindful Mornings with Dr. Matt. It is with great pleasure I kick off this new podcast series, one in which we'll have the opportunity to talk about many different topics specific to mental health and maybe some topics in which you're going to find yourself interested in. And I'm so excited to have my very first guest on the show, Brandy Brock. Brandy Brock is a former student of mine in field experience at Southern New Hampshire University. And I have to say, from the very beginning of our work together and the learning experience that we had in class, I found Brandy to be exceptional. With any assignment that was submitted, it was always high quality in terms of hours that were needed to complete internship, had way more hours than needed well before the time was even there. But even more impressive is what I came to learn about Brandy in terms of resilience, not only throughout the educational program that we were in here at Southern New Hampshire's clinical mental health counseling program, but some of the things that Brandy had experienced throughout life, prior to, during, and even after. And what's extremely impressive too is very quickly after receiving the diploma, congratulations, was quickly licensed, working in the field, immediately found herself multiple promotions, working at multiple locations, and even getting a very first publication, Changing the Conversation About Grief, which was one of the best articles that I've read in a peer-reviewed type of a journal. So without further ado, Brandy, it's a pleasure having you on the show. How are you doing today?
Oh, I'm so great. Thank you so much. I don't know that I can live up to that introduction, but I'm really going to do my best here. There's no pressure whatsoever, right?
Oh, absolutely. I think I have more pressure than you do because, hey, this is the very first episode. I don't know where it's going to go, and who knows what's going to happen
It's
from
going to go
here.
downhill fast. No, I'm kidding.
I hope not. Well, I wish I could promise you many ratings, great reviews, and people coming out to reach you for additional referrals. This could be a flop, but hopefully not. We want to start off on the right foot by having somebody as awesome as you here. And truly,
Oh, thank
you've
you.
quickly become an asset to the field. And I'm really proud of all the accomplishments that you've had. And I hope that you're feeling the same way too.
No, I am. I kind of had this idea when I got started in grad school that I just wanted to hit the ground running with this. As a lifelong consumer of counseling, I've seen the pieces that really, really worked and came together, and things that as a client I thought were brilliant and wonderful, but I also saw a lot of shortcomings and places where I felt like the void could have been filled a little bit as far as client care and kind of techniques. So with these ideas in mind, and the fact that I didn't really get into grad school until, my late 30s, I kind of knew as soon as I graduated what direction I wanted to go. So I just put my head down, focused on school, had excellent guidance by excellent supervisors like you, Dr. G. And so I had the
Yeah.
confidence in the education um, to pursue these things. And I graduated May 2023, and I'm already, I've moved up to lead counselor at my outpatient recovery center. I'm published. I have several other articles and writings that I'm kind of sitting on for now that I'm waiting to
Great
kind
to
of
see you.
tweak and unleash. And now I'm here on your podcast, so I whatever I was planning about 3 years ago seems to be working, so I'm really happy to be here. Thank you so much for thinking of me.
Absolutely. Well, and as you said too, having some of that confidence to see yourself get through a program like that. And as we know, graduate school is rigorous. That on top of everything else going on in life, we talk a lot about work-life balance, But as you continue moving along, and hopefully you start to see it in other areas, having that confidence in yourself. We talk a lot about being successful in a field like this or any other field for that matter. It really does come down to the confidence because
Mhm.
whether you think you can or you can't, you're right. And it really does come down to those beliefs in yourself, being able to go a lot further. And as you said too, there are a lot of gaps in the field, whether that's specific to education, whether it's specific to the health field, not only in our nation, but globally. There are a lot of gaps that we really do need to fill. And this is why we need individuals who are movers and shakers, individuals who have perseverance, the wherewithal, and what have you, to be able to help us get to a much better place. Because it's one thing when you are sitting there as the client in the chair, having the experience of the counselor, comes something completely different when you are being the counselor and you're working with the client. But I think having both perspectives is important because one thing I really held on to, through my year of doing counseling as well, and I've been through counseling in the past year when things got rough, it was extremely helpful for me. But at the same time, in learning what it was like to be that client, helped me become much more empathic, much more in tune with what was going on with my own clients when I had that opportunity. And I see you seeing the same right now.
Yeah, no, so it's like that whole 360 perspective, right? Um, Obviously you enter counseling because you care about people and because you already have kind of a compassionate and kind nature, right? And maybe, if I may even say so, like just like a little bit of curiosity, like what makes the brain work, like what's going on in there, you know? But then you combine that with really unique life experiences, and you combine that with the fact that maybe those unique life experiences caused you to go to counseling yourself. So you get like that entire perspective, add that with proper education, proper training and experience. And so when you have a client walk in, no matter what background, no matter what pathway, no matter what traumas or experiences they have, there is something identifiable within them that you see yourself in, right? And you can think, well, I remember when I was in that situation, people would say this and do this to me, and I didn't react this way because XYZ. So then you can already kind of plan about 4 to 5 different avenues in order to respond to that person, to talk to that person, to offer treatment suggestions to that person, right? Because, you know, counseling is not a one size fits all, right? You kind of have to get creative sometimes and see the individual in front of you and combine that with your unique lived life experience. So, yeah, I think, you know, having that whole combination of being in intensive therapy when I was younger and seeing what worked, but more specifically, really seeing what didn't work, because there were times I left counseling, I was like, this is donkey donk, I'm not coming back here. You know what I mean? Like when I was going through some trauma informed therapy, I think they did more harm than good. So I just quit going to therapy for years until it got to a point where mentally I could not handle average life stressors, because like I just wasn't built with the right utensils. I didn't have the right tools for me. And so now, you know, combining that with the fact that I work in substance abuse now, which obviously involves a lot of trauma, a lot of grief, a lot of crisis, I'm able to literally talk and communicate and bond with every client that comes in, because I may not live their exact experience, but I've been somewhere around where they have.
Mhm.
So I can talk on a level that they relate to. And you can probably agree to this as a substance abuse counselor yourself. If you don't bond and relate to these clients, they don't feel understood and they risk leaving and relapsing. And I take that very seriously. So I want to make sure that I can bond and, you know, be identifiable with my client.
And that's absolutely it. As you said a moment ago, there is no cookie cutter, one size fits
Mhm.
all approach. And fortunately, one of the shortcomings of the field, and especially my work with addiction, seeing what we do with court orders when individuals are going through the system, you know, we have these different workbooks they need to go through, checkpoints they need to complete, and so on. And I'm teaching them things they already know. And few and far between are there many of those opportunities to be able to work on something meaningful to them. So, you know, although they may be in love with the substance of choice, the one that's ultimately destroying their life, you know, we have to realize that going through a process like this is one that is one of the most painful, challenging experiences of an individual's life. And if the only incentive they feel that they're getting out of abstaining from heroin, abstaining from alcohol, or what have you, is just living clean of heroin or alcohol, it's not going to be enough. We need to find the thing that gives them meaning, fulfillment, and so on, the thing they can look forward to the next day in the morning. This is what helps people continue moving forward. You know, but to the other point that you made here a few moments ago, too, you know, people are different. You know, no two people who have ever existed in the world currently do or will in the future perceive and respond to the world the same way. And I know you're smiling right now because you've heard me say that 18,000 times, but it's true. And, but there's also a lot of commonalities, you know, here amongst in between people, you know. So I think really a big part of this is, you know, being relatable, being able to connect with clients, find what it is that works for them. But remember, although every single client who walks in the door is going to be different in some way or in many ways, you know, need have you, so are counselors, you know. So just because you had a bad experience with one counselor doesn't mean that you will with another or with
Mhm.
another or with another. Or one of the things I oftentimes have to say when I'm doing my counseling, working in addiction center, you know, I recommend groups as a supplement to therapy. You know, you're seeing me once a week, once a month, what have you, but you're living your life all the rest of those hours, the days, weeks, and so on. Being part of a group can be helpful. And while I do realize that not every group is going to be a match for everyone, I do think there's a group out there for most people, but it's about finding the right group. So in this case, finding the right counselor. But when we take a look at the bigger picture of what's going on collectively, there's a lot of work that needs to be done. So we need to have more people in place who not only know what they're doing, have the wherewithal clinically, but further are people who truly are compassionate about other people, non-judgmental, people who are willing to listen, people who are willing to respond accordingly without judgment, and people who are there and truly by your side to help you get to a better place. And people like you and many others out there are doing that, but it's important we keep it in front of everybody, which is part of the reason why we're doing this podcast, which may or may not make it.
It's going to make it. We're going to think positively, right?
We'll
No
see. Yeah, we
cognitive
are.
distortion to it.
Positive thinking is a big part of it. Absolutely. Well, as you were speaking a few moments ago, you made it quite apparent that you've had experience with counseling. And
Yeah.
as you said, had somebody you didn't connect with, felt as though the trauma that you had experienced had led to things worsening over time. And
Yeah.
not only did you have a significant trauma that you were trying to work through, those everyday hassles became that much more challenging, almost
Mhm.
as though that straw, the proverbial straw that breaks the camel's back. And I'm wondering, and again, I don't want to press on you to share anything you're uncomfortable sharing, here in the space, I'm wondering if you would be willing to spend a few moments here sharing your story with everybody.
Yeah. So I guess, we'll kind of take a step back just to kind of have context. So, my dad was Army. He grew up in a really broken home. Alcoholism ran rampant on both sides. He and his siblings were pretty much left to fend for themselves. To my understanding, I think his mother was actually a prostitute, which is how she supported the family. And he was like one of five, and he was the youngest set. He was a set of identical twins. So he was one of them. It was his home life was so awful, to my understanding as well, that when he was 17 during Vietnam War, he voluntarily enlisted in the Army.
Okay.
He never deployed by the time he got through basic and everything. It had kind of wound down, but he did have war experience. He was special forces. So he experienced a lot of trauma within the Army and the military system, compounded with the trauma that he experienced as a child, right? So then he meets my mother, they fall in love, they get married, they have my brother and I. And I remember like the very early years, my dad was a great dad. But around the age of 7, he started drinking heavily, or at least I started noticing that he started drinking heavily. And it was to the point where when dad was drinking and you could just see that look on his face, you just wanted to be seen and not heard. So you would just like shuffle out. He started cheating on my mom. Things started getting really bad. Then they went to marriage counseling. He got out of the Army. We moved to Georgia. Things kind of seemed okay. But then things ramped up a few years later. So about the time that I was a freshman in high school, my brother was a senior, and on his graduation night, my dad showed up, who was invited to graduation, and proceeded to present my mom with divorce papers in front of the entire family. So it just kind of broke and severed there. From the time from that night until the summer of 2003, I had not spoken to my dad. I'd made like minor attempts, like I'd try to call him, never answered. I'd send him Father's Day cards. They'd get returned to sender. So there was just no relationship there. And honestly, I was old enough, mature enough to kind of be okay with that. So we just kind of thought, okay, dad's in a distance. He's down in Miami. There's no big deal. So I graduate high school, May 2003. And then on July 16th, 2003, I'm home alone one day. And there's a knock at the door. And, in 2003, there's a knock at the door. You answer it. Unlike today, we kind of dip and dive and try to
Sure.
like avoid who's outside. Unless it's Amazon, then you welcome them with open arms.
All right.
Um, so I opened the door, and a man that I did not recognize just kind of like busted through the front door. And it took my brain a minute, because it'd been almost 4 years for me to register it was my father. And he did not look well. He was very bloated. The whites of his eyes were yellow. Like you could just tell, even though I hadn't seen him in so long, something was really off.
Mhm.
So I let him in the house because, again, I'm 18, and like, even though it felt uncomfortable, I don't know any better to look for red flags or to like protect myself. Long story short, my dad, because the divorce was still going on, told me he was going to end the divorce that day. And I'm like, okay, yeah, cool. Like, can I help you with that? Like, why are you here? And with that, he proceeded to pin me down, and he tied me up and carried me to the back bedroom, where I basically was held hostage for the next 4.5 hours while he threatened to kill me and my brother and my mother. He told me in detail what he was going to do, which, I'm not going to repeat here because I know we're on a time frame and this isn't a counseling session. But through that process, I somehow gained his trust, and through gaining his trust, um, I was identifying with him like, yeah, you're right. Mom's at this, mom's at that. Like this is shenanigans. Can I have my arms cut? And he would cut my arms off. And finally, he stepped into the bathroom, and because my arms were cut, I had slipped the ties off my feet, and I ran out and threw myself in front of a moving car because I told myself I would rather die this way than through the hands of my father. We ended up calling the police. She took me to call the police because neither one of us had phones on at the time. We called my mom. And during this entire process, my dad had barricaded himself in the house, set fire to the house, which it was completely destroyed. And then he shot and killed himself in that house. So that's the trauma that I had at 18. My mother was encouraged by friends around her to go ahead and put me through trauma counseling. There was a gentleman, so I grew up near Glencoe, which is a really big government training facility. So they train like CIA, Marshals, Border Patrol. Back then it was like FBI, name it, and they had a training facility. And because PTSD was just then kind of becoming very well known and accepted, they had trauma-informed therapists, and my mom had connections. They pulled some strings, and they said, hey, let's get Brandy in, because the sooner we start addressing this, the better she's going to be. And this is like 4 days later. I'm like, I'm fine. Like, I'm fine.
Still in shock.
I was in shock, right? I mean, I probably wasn't fine. I felt really fine at the time because my thought process was better him than me. It's fine. I'm fine. I'm fine. So we end up going to this therapist. Now, keep in mind, I just experienced this trauma with my father, a male. This is a male counselor that they set me with on a Saturday. And they literally locked me in a room with him all day. All day. And every time I would try to leave, my mother was meeting me on the other side of the door. And she's like, you will be homeless. I will kick you out if you do not stay in this therapy session. Because she was traumatized too. She thought she was helping me, right? So I'm in this room with this strange man all day who's telling me to close my eyes, tell the story again. Tell the story again. Now you're going to tell the story and you're going to focus on colors. Now you're going to tell the story and we're going to focus on what you're feeling. Now we're going to tell the story and we're going to focus on what your dad was doing. Now we're going to tell the story. And this, like, I literally had to tell that story from so many different perspectives. By the time we left, I was completely numb to it, and I completely shut down and withdrew from the trauma. I threw myself into drinking. I threw myself into drug experimentation. I threw myself into really horrible relationships. And I couldn't hold a job because my brain, I could not function. I could not handle stress at that point. Like you mentioned, like the small stressors. I enrolled in community college. I couldn't handle it and I had to drop out. I left jobs because they were like, oh, the phone's ringing and you have to answer an email. And I was like, this is too much. I can't handle it, right? Because my brain was frozen in that moment as an 18-year-old child. I wasn't even fully developed, and I had to face this like life-altering, situation. So it took me until I was 18 when it happened. I'll say I was 22 when I finally decided that my mother and I had a big heart-to-heart conversation, and I realized my mother did not spend all this time raising me to be a good child to throw it away because my dad came in and disrupted my life. I can't blame him. I made these choices. My life is chaos because I made these choices to make it chaos. So it's up to me to fix it. So I ended up seeing this brilliant social worker who is still in practice, I believe, Jim Lanier. He's down on St. Simon's Island, Georgia. And when you're in grad school, you talk about the act of silence as a counselor, right? Which is something I struggled with constantly.
We're talkative people.
Yeah. I can't be silent because I feel the impulse to have to fill it, right? I'm not kidding. The first 3 sessions with Jim Lanier, I didn't say a damn word. He had this big, ugly, like yellow pillow, like clutch, like throw pillow. It was so ugly, but I still remember in detail exactly what it looked like. And I would hug that thing like a life preserve, and he just held space like, hey, you ready? Like, you got anything to say? No? Cool. And we would just stare at each other for a little bit longer. And he'd be like, do you want a water, weather? No, we're still not. Nope. Okay. And finally, like the 4th session, I walked in and I didn't pick up the pillow. And I said, well, I guess if I'm going to be forced to be here, which no one was forcing me to be there. I said, I guess I might as well tell you everything. So I just like word vomited everything out. And he just sat there and took it all in. And he told me, he said, damn, you're the most dangerous person I think I've ever encountered. And I looked at him and I'm thinking, me? Dangerous? What's so dangerous about me? He's like, you have become so numb to the events that happened. You have become so numb to your feelings, your emotions, your responses, the people who love you around you. He says, you are literally playing with fire. He said, no, I'm going to do you one better. You are holding a loaded gun to your head and your finger is on that trigger. And I don't think you give a shit if you pull it. And he called me out so fast. And that was my turning point from him. You know, he worded it in a sense that, you know, you're literally telling your trauma story like you're at a restaurant saying, I want a cheeseburger, hold the onions.
Mhm.
He's like, it should not be that detached, especially for something that just happened a couple of years ago. And I worked with him extensively, and he's the one that taught me kind of the concept of forgiveness. You know, he told me, until you get to a point where you forgive, you will never fully live. And that's kind of a motto that I hang on to myself. I don't push a lot of my clients for that. I do think forgiveness is a personal choice. I do think people can heal without it, you know, but from where I'm sitting, I needed to give that forgiveness. And I was able to earn that forgiveness and give that grace towards my father. I think my father loved in the capacity that he understood love. I know for a fact he had a lot of significant mental illnesses on top of that, probably mostly undiagnosed. I'm so far separated, I couldn't even guess at this point what he was dealing with aside from alcoholism and PTSD. But, you know, I can love him as a father. And I think I struggled with that for a long time, which kind of caused this domino effect. Um, I can love him for the father that he was. I can love him for the fact that he gave me life. I don't have to love what he did to me, right? And then I also like going back to that lesson of compassion and empathy. Now that I'm a parent, I kind of put myself in that position like, how desperate do you have to be in that moment to think that killing your entire family, including your children, is the only option you have? He must have been in such a desperate place. And I can only imagine how scared and fearful he was. So I'm in a place where I can accept all of this. And I have been able to put that trauma behind me. It exists with me, but it doesn't control me anymore because I had a brilliant counselor, a social worker who called me on my shit when I needed it. And then more specifically, gave me the tools that I needed in that moment. When the first counselor that I met, I feel like he did way more harm than good. And then I've had a couple counselors after Jim whom I just didn't click with. They were too person-centered. They're all about validating when I needed to be more challenged because I walk into counseling these days very self-aware. So I need someone that kind of challenges me and again, calls me out of my stuff. But those are my experiences with some of those counselors, with my experience with being the client, you know, good and bad. And, you know, my story of my trauma, which I don't think I ever shared with you, that particular aspect of my life, I do keep it close to me. I mean, I'll talk about it. I can't, it happened. But I think that incident unknowingly set me on a lifelong course to be where I am. You know, at that time, I didn't want to be a counselor. I couldn't deal with it. I was like, I don't want to deal with other people's problems. I have my own. But then somewhere in my 30s, I kind of matured. Mom got cancer. And I just remember like sitting in the kitchen during COVID and being like, man, I've had such unique experiences. And I feel like it's been really hard for me to find someone that understands where I'm coming from. And that sucks for me. And then I thought about it and I went, but I can be that for someone else. So it was in that very moment, like lightning, I decided that I wanted to become a counselor. You know, and I like to frame it kind of, I've used this phrase before, that in that moment, I think I became what I needed the most.
Absolutely. Well, I mean, and again, thank you so much for sharing your story. And there's so many valuable points. I'm going to try to highlight a few things
I
here
know. I'm
real
sorry
quick.
that was long-winded.
No, no, I wanted to let you go on because you have a story worth hearing. And again, as you said, you hadn't shared all those details with me before. And do know that my heart pains for this, but at the same time too speaks even further to how resilient of a person you are and just truly, you know, how remarkable, you know, you are to overcome the things that you've overcome, because many people would just give up and fold, not know where to go from there. And I think one of the underlying themes that we really had here throughout what you were stating is that of choice. People have choices, and as bad things happen to us, it's harder to recognize that there's a choice. You know, we're feeling pain, we either detach from it, numb, or go off the substance use route, or we start to hate and attack and blame everybody else for everything else. The reality is, the world is neither fair nor unfair. It is what it
Mhm.
is, and bad things happen to good people, like yourself throughout this experience. But a few important things to really keep in mind is, one, when you ultimately made the choice to talk about it, the choice to be able to move forward, the choice to not remain stuck. Because here a big problem that we see with a lot of people when I try to describe when I'm in the counseling chair, instructing in class, is that it's not what happened to a person that defines them. It's what they choose to do or not do with it that ultimately defines them. And when it comes to the act of forgiveness, forgiveness is a very high level thing. And we have to realize that we're holding on to animosity, holding on to that hate, holding on to resentment, and so on. Ultimately, we're punishing ourselves because as we're holding on to that and not forgiving the other person, it's stewing inside us. It's toxic. It's destroying our immune system. It's occupying our thoughts, our feelings, and so on. Ultimately, we're punishing ourselves by not letting that go. So I think one big misconception when it does come to forgiveness is that it's about the other person, when in actuality, it's for yourself. You can forgive somebody. It doesn't mean you have to be best friends or welcome into your life again. You can have nothing to do with them again, but it's about letting go and moving forward with life, which is what you did. Going back to the beginning with the first counselor, with what you were sharing here in terms of that trauma individual, I take it, at the military, um, that's a complete opposite of what we discussed today in terms of trauma informed care. What we say when it comes to trauma informed care is when you have a client, we don't want to re-trigger the situation. So if I have a client
Mhm.
who's coming into me who's experiencing suicidal ideation, homicidal ideation, I'm assessing you in the here and now for safety. I'm trying to figure out, do you have any protective factors? Do you have
Mhm.
support? What's the likelihood of you following through? Last thing on my mind is to have you repeat the story of what it was that led you here in the first place. We
Yep.
wait till you're in a better space for that. Not only in your case, you do it once, twice, thrice, four times, five times, continue doing this. That's just one cycle after another, after another, after another, after another, after another of trauma. When in real life, what we should be doing is you don't force a client to talk about these things, and you can't force anybody to do anything. Said you can't force somebody into counseling either. Even if you're court mandated, you have a choice: either come in and
That's true.
participate or face a legal consequence.
Yep.
But here in this type of case, if the client is in a safe space in the moment, we're not going to go pressing on these different things if they're not ready to talk about. So the approach that you have with the social worker, where you sat there 3 sessions, holding on to the pillow as you did, like the life preserver, that is much more appropriate. Because unless I think you're going to harm yourself, I have to go in with some of those more invasive questions. Otherwise, we should be moving at the pace that works for you. So I'm extremely fortunate that you found that, because it's been a pleasure having you in class and the way you've influenced the peers as well as being here and story you're sharing. I think you're grateful for that because you've been able to move forward with your life. But think about all the other people now who are going to be impacted due to that social worker helping you get onto the right foot here once again, regain your footing. Now, all the people in the world you're going to be able to help. And when it comes to that help, I know there's a lot of debate out there as to whether or not altruism exists. And altruism, for those of you who don't know it, it's simply doing good for other people, not to accept any benefit in return. You're just doing good for other people. But I'm going
Mhm.
to tell you, it is part of the human experience that when you do good things for others, when you're righteous and you do it meaningfully so, not just to get your name out there for notoriety and things like this, but when you're genuinely doing to help, that's as great of a reward as it gets. So as far as I'm concerned, whether true altruism exists or not, I don't care. As long as people are doing good things for people, helping move forward. But whether or not it does exist, I see you as somebody who's extremely resilient. You've gone from victim to survivor to what we would call the warrior. You've gotten past that. You've chose to push forward and break through all of this. And you're somebody, again, to keep going back to that word resilient, because I do think resilience is one of the keys to success in life. I see many intelligent people who may have plenty of resources, they're affluent, grew up well, and so on, but they're not resilient. And the slightest thing throws them off track. You can be the smartest person in the world, but if you can't roll with the punches and move forward, you're going to remain stuck. So it's a little bit of something else. And, everything that you're speaking to is exemplary of exactly what people need to be successful in life, continue pushing forward. But it's not an easy road at all by any
No.
stretch of the imagination.
No, it's not. I mean, and that's the thing, right? It's all within yourself. You have to decide that you're going to get better and you have to utilize the tools that are presented to you. And this is one conversation that keeps coming up in my outpatient, with substance abuse, and which now we're doing primary mental health too, and especially my primary mental health clients, they're like, how do I know I'm getting better? How do I know I'm getting better? And I'm like, I hate to get all counselory on you, but like you tell me, like I can't judge that. Like you're here because you recognize you need help and you want to do the work. How do you know you're doing the work? How are you applying what we talk about in these real world situations? How are you measuring your growth? Because in substance abuse, it's easy. Oh, I'm 516 days sober. Like that's, you can rate your progress, but with mental health, it's different. All you can do is just show up every day. Consistency is something else I talk about. Be
Great card.
consistent in your actions and behaviors. Be consistent in your routines, right? You're not going to get it perfect the first time. No one ever gets anything perfect the first time. But what happens is a year from now, you're going to look back and realize you're a completely different person. And it's such a subtle change. You don't even notice it. You don't get that light bulb moment when it comes to, mental health. It's the consistency, the persistence, applying what you learn. And, part of that is becoming resilient. And, that kind of rolls into like the whole self-efficacy. Like if you're resilient and have the tools to be self-efficient, you literally are psychologically flexible to overcome anything.
Mhm. Oh, absolutely. And you struck upon something else important, really great with the whole light bulb analogy here, in that we're trying to wait for this big moment, the light bulb goes on, I've arrived, I made all the changes and so on. People so often are waiting for this big magical thing to happen, whether it's self-improvement, whether it's doing good things for society and so on, this big grand gesture, if you will, is we miss the mark. It's about that intentional, consistent, gradual type of change. One of my favorite phone calls I get in practice of a new client calling, yeah, hey Matt, I'm taking a look at your services. You look like a good counselor. Here's my problem. How many sessions can I expect to see you? I'm like, well, let's not try to quantify the number of sessions you need to see me before you even get in the door. And maybe your managed care has a limit on the number of sessions you get, perhaps. But
Yeah.
either way, it's about the progress you make. And like, when clients ask me a question, well, am I making progress? Well, do you think you're making progress? And they look at me all stunned why I asked them. I'm like, well, you're really the only one who can answer that. I can speak externally to what it is that I'm seeing. Okay, yeah, you've been brushing your teeth lately, you've been wearing, jeans instead of pajama pants, your hair is fixed, you're applying for jobs. I would say that that's progress. I mean, but again, it's your life, it's your direction, it's your choice. I can't tell you what's progress or not for you. We all have to determine that ourselves. So that self-efficacy piece is ever so important. Now we're kind of getting at this point of the conversation where I feel like we could probably go on for 2, 3, 4, 5 hours and we just go on and on with this. So with that being said, I'm thinking we're probably going to revisit and do another one of these here in the not so distant
Love it.
future. But with about, I got about like 5, 6, 7 minutes or so left to go with this episode. I wanted to ask you, ask point blank. So that article that you wrote, Changing the Conversation About Grieving, pulled at my heartstrings. I thought it was a beautiful, beautiful, beautiful story that you shared with everybody. It was touching on a personal level, but even at a professional level in terms of, the clinical awareness and so on that was written in that. I think there are a lot of valuable lessons for people to learn, whether you are the client, whether you're the counselor, just somebody else in general, trying to support somebody who's dealing with the loss of a loved one. So I'm curious, what are some of the key takeaways of what you wrote in your article? Or at least the
Yeah.
ones you want to deliver that you hope people land on as they read this.
So with that article, I was really inspired after my mom passed away. My mom died of cancer in 2021. And I never grieved like that, nor had I had people reach out. Even after my dad died, we just didn't participate in that process. We were completely elsewhere. But I was very present with my mother, and I saw kind of some of, we talked about shortcomings earlier. Shortcomings both within the counseling mental health field as well as just how we as human beings interact. And I want to be very clear, most people have very good intentions. I just don't think people who have ever been put in that type of situation know what to say. So it's like these filler statements like, oh, well, let me know if you need anything. Anyone who's ever had a significant loss knows that you're walking around in shock for weeks. You can't articulate, think, you don't know what you want. And even if you do know on some level, you may not be able to communicate it or have the energy to even ask for it. So one of my takeaways from that experience, which is included in that article, is that, don't leave it open-ended and leave, that responsibility on the bereaved. Be
Mhm.
very specific and intentional with what you're offering that person. Like, hey, I know you have two small kids. Let me come over on Thursday. Let me take them out for a couple of hours while you shower, nap, take care of things. Or, hey, I'm going to bring over dinner tonight. I'm going to come over. You don't need to do anything. Don't dress up. Don't get out of bed. I'm just going to come and do laundry. Hey, I want to take you out, do this, that, and yeah. Like, be intentional with what you're offering, right? Because what happens is you are leaving that responsibility on them. And what's even more disappointing, and G, I know you can probably attest to this, is when you do call and ask for something, people very often are not going to follow through.
This is true.
Oh, okay, well, Friday's not a good time for me.
Mhm.
Okay, well, that's what I needed. So
See what I
never
mean?
mind. I'm just not going to ask for help now. And that makes you feel like a burden at that point. I think additionally, too, when it comes to grief, is, you know, kind of learning how to be responsive to that person. Let's be aware a little bit that maybe they're not religious. So saying that, hey, they're in a better place might already kind of add to the grief, right? And this is kind of where I'm at the point of like deconstructing the stages of grief as they are the Kubler-Ross stages of grief, because quite honestly, they're not correct. They were, implicated and observed on individuals who are chronically ill, terminally ill, and already dying. So they're not really relevant to those of us who are not dying. So I think a part of that is like coming to terms with our, mortality, and even having an existential crisis for many, right? I think that's pretty common from the people I've talked to and from what I experienced. So when you start bringing up religion, unless you know for a fact they are like staunchly religion, you're adding to that grief and unintentionally, right? Because they're already kind of
Or
experiencing
in
like,
some cases intentionally.
well, it depends. That's correct. But just being more, more choice words, and how we're going to support that loved one. And I also believe it's really nice too to just kind of like leave it open ended, like, well, I really don't know what to say. So, but when you're ready to talk, I'm here. Just having the simple conversation. You don't have to have the answers. You don't need to offer comfort to that person, because to be quite frank, no matter what you say isn't going to make them feel better anyways. Oh, she was a good person. I freaking know she was a good person, which is why she deserved better.
Oh, absolutely. And that's an important point too. I want to freeze on
Yeah.
that just for 1 second here. Is the whole I'm sorry, I'm at a loss for words. I don't know what to say
Yeah.
because as you said, I mean, there really is not anything to say. And, I've had a handful of times, even in counseling sessions when I'm working with clients who are crying before me, went through a difficult loss, and I'm supposed to be as the counselor, the one with the words, the wisdom, and so on and so forth. But I've had certain things brought to me where I just look the client dead in the eye. I'm like, that is heavy. There are really no words to put upon this. So I'm not even going to try to. Let's share the
Mhm.
space together for a few moments and, you know, we'll see where we can get. And, really,
Yeah.
and that's okay. I think that's a lot more genuine than trying to make up things or just like Hallmark statements and so on. Absolutely.
Yeah. Like I said, they're kind of like filler statements, but I think it's okay not only as counselors, but just as regular human beings to just, like you said, hold that space and say, I can't imagine. I have no words, but I'm here in any capacity. Like if you need to talk, call me, we'll keep in touch. And that's another thing too, is that, when I was going through my grief at like month 4, I had such a significant resurgence of it. And I was speaking to my grief counselor at the time, who she was brilliant. She's up in New Hampshire. She was one of the other ones I clicked very well with. She definitely saved me in a lot of ways. And she told me, she's like, oh, because about 3 to 4 months, it's quite typical for a resurgence of grief. Do you know why? And I was like, well, obviously not. So I'm asking you. And she said, because people stop checking in on you. They think, oh, okay, her mom died 4 months ago. Brandy's got this. She's good. She's over it. But there is no time frame for grief, right? Like maybe in 4 months someone's over it, and maybe for someone 4 years they're not over it, and that's okay, right? There's no time frame. There's no true process for any one person. It's just it is what it is. So I try to be very mindful after that, that when I have friends that have lost spouses and parents and any type of significance, I check in beyond the 4 months, because like I remember how I felt abandoned, and when I reached out, no one was reaching back. It's a very lonely feeling, and it makes you feel like something's wrong with you. Like, why am I not grieving in a normal way? And that's another part of this article, is I just kind of wanted to like shed light, and as I'm continuing to write on grief, is to shed light that what we've taught as proper grieving isn't what normal people go through. And so I think there's like this feeling that like something's wrong with me, because like it's been 4 months and they're right, and I'm not over it. Well, you shouldn't be. I don't know anyone who could be over a significant loss in 4 months, but society expects you to pick up, go back to work, take care of the kids,
Or
stop
here's
talking
2
about your
days off
feelings.
from your job for,
Yeah,
you
like, why are you still
know,
dwelling on your mom? Like,
yeah.
that was 5 months ago. Like, it's over.
Well, it's horrible. And again, to each their own, there's always individual differences, and that's something we really want to be in tune with. The way that I see it, and I can say I haven't experienced the
Yeah.
significant extent of loss that you have. But the way that I see it in terms of my lived experience, as well as what I
Mhm.
know of other people's lived experiences, is rather than saying that there's a point where we get over it, I don't think you ever get over the loss of a loved one, especially somebody like your mother and the situation you experienced and so on. You don't get over it. Rather, it's about learning to adapt, learning to live with it, learning to move forward. So I'm working with a lot of clients, or even speaking to people in my everyday life. I'm like, you really got to consider here, what do you think your loved one wanted for you? If they could have imparted something on you moving forward in your life, what do you think it would have been? Or let's flip it around. If you were the one who had passed and your loved one was grieving you, what would you want for them? And it's always something positive. It's like, oh, carry on legacy, live your best life, have that family you always wanted, get the job you always wanted, have those lived experiences, go on vacation, so on and so forth. I have yet to find the person who lost a loved one who said that they would wish illy on them, or in reverse. And to that point, I say, let's carry on the individual's legacy. This is how loved ones live on forever, is by being the best version of yourself, carrying on or carrying forward the best versions of them, telling their story and so on. This is how we do it. But you're going to have good days, bad days, and everything in between. It's always going to be with you. And I think that if we try to look for that point of getting over instead of working
Mhm.
through, you're never going to get there. You're trying to aim for something that's unattainable. And this is where people continue to find themselves stuck. It's really true. And just so much of what you said is so true. And why a lot of people, struggle with the grieving process and so on. It is an uncomfortable thing to talk about. Human beings
Is.
hate facing or talking about their mortality. And then once they get close to that point, yes, it's the center, spotlight of things as it comes up. But really, we need to do a better job with this conversation. Everything that you've shared, I think, has been really helpful here. Well, I know
Thank
we're at
you.
that time, so I want to give you a moment. Any concluding words here as we wrap up?
First and foremost, had so much fun. I'm really sad it's coming to an end. But again, I do want to thank you for inviting me to be your first guest on your podcast. I know it's going to be brilliant and wonderful, and it's going to help a lot of people. But as part of my takeaway, I don't know. I am a big advocate for understanding and breaking the stigma around grief, because even within our field, I feel like grief, it's still whispered. Like, oh, like grief, we don't talk about it.
Mm-hmm.
We don't talk about loss.
Yeah.
And I also think it's strange that it's not a diagnosable problem in DSM. It's so much more than depression.
Now we're talking about prolonged grief
It's
disorder.
so
That
much
could
more
be.
than adjustment disorder.
Mhm.
So really, I guess my takeaway is it always gets better. And I know it sounds like a dumb, trite counselor-y thing, but I try to teach and tell my clients, it's progression, not perfection, right? As long as you're constantly working and striving towards things, you're going to have unintended consequences, both good and bad, right? But what happens is eventually that good's going to start outweighing that bad, because you're goal oriented and working towards it. So, for anyone who's watching this, who's struggling and feels like that they can't come out the other side, like it's going to be sloppy and messy and it's hard work. But again, we're measuring for progression and not perfection. And kind of building towards what we talked about, resiliency and self-efficacy, which I think is everyone in the world could, learn from if they actually, properly apply the tools. So, but yeah, I just love people and I just want the best for them. And I think everyone with the right tools and the right coping skills can lead unbelievable, brilliant lives. And I look forward to playing a part in that. And I do really think, even though it sounds naive and simplistic, that people are wonderful and really good at their core. It's just life is hard and we're not always given the best skills in life to cope, but they have the opportunity to change that. I think they're capable of really wonderful and incredible things.
Wise words from a wise woman. Thank you very much for everything that you just shared right here and there. And, back to that point about, things get better over time. Back to what we
Mhm.
said earlier, it's about intentionality and
Yeah.
consistency.
Yeah.
Remember, it's not a passive type of process. You got to do the work on you. And while further away, it does, it takes you further from it. Maybe the feelings aren't going to be quite as strong. You got to make sure that you're doing the work as you continue moving forward. And remember, that is a choice on you, as hard as it is to see, especially there in the moment. Choosing you and moving forward is going to be the way to get there. And Brandy, in closing, how may our viewer or viewer, our viewers or viewer, depending on how this
The
goes.
one viewer.
Yeah, there you go. Aside the two of us, be able to contact you moving forward if they have any additional questions, comments, or otherwise.
Yeah, so you can reach me at my professional email, which is B as in Bravo, LLC @gmail.com.
All right, sounds good. Well, thank you very much for being the first guest here on the show today. Wishing great success to you and otherwise. Thank you, everybody, for tuning into this, and I'm looking forward to sharing our next video with you here next week. Signing off on Mindful Mornings with Dr. Matt. Thank you, Brandy, once again. Wishing you all a wonderful rest of your day and week. Take care.